All Coloradans 16 and older are now eligible to get the coronavirus vaccine. The governor says in the beginning it will take both patience and persistence to get an appointment, but he assures there will be enough doses for everyone to get their first dose in the next 6 to 8 weeks. Here now is CBS 4 medical editor Dr. Dave Hnida. Dr. Dave, while there is a rush to get a vaccine, we know that there are still people who are hesitant to get the shot. What is your message to anyone who may not be sure?
You know, it's funny. I don't think there really is a one-size-fits-all message. There are people who have very legitimate concerns and hesitations about getting the vaccine. So I think, you know, really the question becomes asking people, what would it take for you to get a vaccine? For example, if you take a look at people who are concerned because the vaccine may not be safe. It was developed too quickly. There are scientific concerns. I think those folks really should turn to their doctor, a trusted healthcare provider, for accurate information. They certainly don't want to go to, you know, Dr. Facebook, which unfortunately can be a place where there are people who are literally committing COVID information malpractice. And then you take a look at some communities which have a mistrust or just hesitancy about vaccinations from a government standpoint. And I think in those communities where there is a sense of mistrust and hesitancy, you really want to turn to community leaders. You want to take a look towards religious and spiritual leaders in order to give some good guidance and good information and good example for getting the vaccine. And then I think when it comes to people who maybe have hesitation due to philosophical or even political reasons, I think this really is a COVID golden rule moment where you really need to ask, you know, would you want your community, your loved ones, your friends to protect you? You certainly have really a duty here as a member of our community to protect others by being vaccinated. That truly is a COVID golden rule moment. This is a situation where the sooner we get everybody vaccinated, the sooner we will wind up protecting our loved ones, our friends, our community, and the sooner we'll be able to get things reopened totally, the sooner we're going to be able to keep kids back in school, and we will be able to get back to a more normal life.
A lot of great information right there, Dr. Dave. Now, there have been a lot of new studies about the vaccines and the protection they offer. What are some of the most promising developments?
Yeah, there really has been some pretty good stuff over the last week or so when it comes to vaccines. I think one of the most important ones is just how effective and safe the vaccine in a real world setting. You know, we took a look at, for example, Pfizer and Moderna and looked at them in the context of, you know, controlled clinical studies and came up with this 94% efficacy rate. But, you know, when you take a look at what the CDC just put out, and that was research that looked at a real world situation where we actually have vaccinated people who are not included in studies, people who are elderly, have underlying medical conditions, pregnant women, people with compromised immune systems. Those people had a 90% protection from getting COVID and 100% protection from severe illness, hospitalization, and death. So the vaccine is really shown in the real world to be very effective. And also, it is shown to be effective against the variants that are circulating. So that's why it's important that we do get the vaccinations done as quickly as possible. I think it's also, you know, a situation where we really are looking at the situation where we're kids in this whole equation here. And the information on that has been very positive. Pfizer just came out with some research showing that kids between the ages of 12 and 15 were 100% protected against COVID with vaccination. And so when you look at that, it does give hope that we'll be able to get middle schoolers, high schoolers fully vaccinated before we wind up reaching the fall school year. And then finally, you take a look at one important thing, and that is fully vaccinated people do not appear to be really a great risk when it comes to carrying and transmitting the virus to others. That is, once again, after they are fully vaccinated. That was something we were really concerned about. Could you carry the virus and give it to others? And it seems like it is much less likely than we initially thought.
All right, Governor Polis has extended the mask mandate in Colorado for another 30 days. How much longer do you think we'll all have to wear masks?
What I think and what may wind up happening, maybe two different things here. I think at this point you take a look at mask mandate being expanded or extended out another 30 days, and then there's going to be probably during that time some relaxation of the mask mandates, as well as kind of a transfer of mandates to a more local level. And the question is 30 days going to be enough? And, there are some things that kind of put that into question. And particularly you take a look at what's going on in the state right now. Right now we've plateaued in terms of cases. Our test positivity rates are, they're around 5%, which is not where we want to be. We also look at what's going on around the country. We're seeing that variants are really taking a huge toll in areas such as Michigan, the East Coast, and we're not isolated or immune to having those variants come in our direction. And then you take a look at the fact that we haven't gotten enough people vaccinated. I know it's wide open to others, and basically everyone can get vaccinated. But the question is, when will they be vaccinated, and when will they be fully protected? I'm really thinking, we do have another probably 60 days before we can really go, okay, I think we're really starting to reach a point where we can let our guard down a little bit more, because we will get those vaccinations done. Vaccines really do tend to be a key component of this, obviously. And that's why the masks really aren't that hard to do, as well as other guidelines in terms of protecting ourselves. I think we really don't want to be spiking the football before we cross the goal line here. And I think that really is kind of a little bit of a concern.
Yeah, no one wants to get caught at the 1 yard line, I'll put it that way, especially when you deal with COVID. Dr. Dave, thank you so much for your time. Really appreciate it. All right, and we're going to talk to Dr. Dave. We're going to have more information next Monday at 11 a.m. to get more coronavirus and vaccine questions answered. With that, we'll be right back.